Hello and welcome to Read Scholars Live. I'm your host, Dr. Mary Fleming, current president of Read Scholars. And today I am so excited to have Dr. Annelle Primm with us, who is the senior medical advisor for the Steve Fund. How are you today?
I'm doing well, and thank you so much for having me. What an honor.
Thank you for being here. I'm excited to share with our audience a little bit about your history, but also the work that you're doing with the Steve Fund, because I think it is clearly needed in this time and space, but also very unique. And, here on the Read Scholars and the Read Scholars Live, we champion those who work with the most vulnerable of our populations, and you all are definitely doing that. So, um, before we get too far into the Steve Fund, let's talk a little bit more about you and how you got there. So, tell us about, why medicine? Like, why did you decide to go into medicine?
From a very early age, I was interested in medicine and actually psychiatry because I listened to people's problems and helped them solve them. My dad was a physician, and he was certainly a major influence in my life. He took me on house calls with him in Long Island, New York. And, I remember his black bag. And in fact, I still have his black medicine bag with his prescriptions and um, medical instruments in it. And I was just really fascinated how he would engage with the families that we visited. And, there are actually connections to some of the work I did, later on in my career doing home visiting as a psychiatrist in sort of community treatment. But anyway, back to the early days, I, excelled in the sciences in my schoolwork, and I, had some opportunities doing things that were either related to science or related to health in some way during the summers. I worked at the Methodist Camp Service in Harlem, New York, and I would take weights and heights of the campers and gather other information from the families. And I worked in a lab for a while during the summers. And so, I had some good exposure. I even accompanied my dad to some conferences, medical conferences. And so I got a flavor of that aspect of medicine, the lifelong learning aspect. And I was pre-med in college. And I started out wanting to go into, actually, by that time, when it was time to go to medical school, I thought I wanted to go into OBGYN, I think, which is your specialty. And once I got into medical school and did my obstetrics rotation, my resident, I think, was maybe a little lazy and only wanted to do C-sections. He did not want to do regular deliveries. And I realized I really did not want to be a surgeon. I think you just have to be honest with yourself. But alongside that, I really enjoyed reading about psychiatry. I enjoyed my psychiatry rotation, and it was actually pleasurable for me. And I finally came to my senses and decided to follow, that trope into the mental health profession. So maybe I went too fast, through my progression, but that's what brought me to this point. I will also say, and I think this is important, that my dad was an anesthesiologist, and in the 60s got very interested in addiction medicine. And by the way, my Dr. Benny Primm, he passed away a few years ago, but he was an addiction physician and ran an addiction treatment program in New York City. And I became very sensitized to the social aspects of medicine, the social context in which people live, what we call the social determinants of health, which were very prominent issues as it related to people with addictions, and it was primarily heroin addiction that he was treating. But he believed, and I also became a believer in the importance of all of the other supports around that person. My father was an anesthesiologist who got interested in addiction medicine in the 1960s when it really wasn't a very popular specialty. But he focused his efforts on treating people with addictions, primarily heroin addiction. And what I learned from that, and which was a really amazing influence, was the social context of medicine and the fact that the things around the individuals receiving addiction treatment, such as housing and job opportunities and education, were really important aspects, and also general health care too. Many of the people had not had those things, and really, I think the absence of those opportunities and supports and resources really set the stage for people to, become addicted to drugs in the first place, in very, despairing conditions. So these are the social determinants of health that we talk about. And I really got a good taste of how important those are. Our treatments as physicians and, healthcare professionals, medications and other treatments and so forth. That's not all there is to health. And I really was immersed in that, and that had a great impression on me as a physician. And so that the psychiatry that I ended up practicing was very much in the community. And I do consider myself to be a community psychiatrist. And, I've practiced in Baltimore, Maryland, which is a very urban environment, surrounding Johns Hopkins Hospital, which is where I had my psychiatry residency training. And I also received a Master's of Public Health degree from Johns Hopkins, and kind of married the two, the public health approach, focusing not only on the one-to-one doctor-patient relationship, but also having a population perspective. What's going on with the community? What does the community need? What are some of the resources? What are some of the barriers to people getting health and mental health care? So all of those things were on my mind, and bringing the care to the individual, not always expecting them to come to our offices and hospitals and so forth. So I could go on and on about that work, which I love so much. But I'll give you a chance.
Well, I was gonna underscore one thing and share one thing, but for any of our students, especially our medical students listening, and talking about your rotation experience and really honoring what speaks to you. I think myself included, I went into medical school thinking I was going to do one thing, and I took a complete 180. We'll talk about my story another day, but just applauding that you understood what was important to you, where you would thrive, and it's okay to change your mind and make that decision in real time. To just for the students, and a little bit before I want to jump back into the social determinants of health a little bit, but you talked about your dad being ahead of his time. Talk to us a little bit about, because you were a little bit ahead of your time. Talk to us a little bit about the stigma, especially in the Black community, around mental health care, accessing mental health care, and then why you decided that you wanted to, take that on. I mean, you talked a little bit about being primed with your dad, but it's an evolving field. I mean, right now we're talking about mental health all the time. You get calm apps on the TV, but that wasn't 20 years ago. We weren't primed in the same way. So tell us how you decided you weren't going to be intimidated by that part of the field.
It took some doing, because there was even stigma in the medical professions. Very few of my classmates, I went to Howard Medical School, um, maybe one other chose psychiatry. It was not a popular specialty to pursue at that time. And some people felt like, you were wasting your medical education by going into psychiatry. And, for people in the Black community who really didn't believe in going to see a psychiatrist and talking to family's business, to a stranger and that sort of thing. It was a foreign concept. And I have to admit, even my dad didn't completely understand mental health. Now you would assume, okay, he's an addiction psychiatrist. We now call, mental health and addictions under the umbrella of behavioral health, quote unquote, which I don't completely agree with, but that's the term that's being used to cover both of them. And at the time, there was such a disconnect, that if a person with both a mental illness and a substance use disorder showed up in one or the other settings, they would be told to go to the other place, get that mental health taken care of, or get that substance use disorder taken care of before you come back. I think I helped to educate my dad about how important it is to acknowledge and treat both conditions, because they can feed each other. Otherwise, for people who have co-occurring disorders, and the stigma extended beyond that as well. For people who have strong religious roots, many of them felt that, if they prayed hard and if they would go to church or the mosque or whatever their religious space was, that should protect them from any mental health concerns. And so, upon recognizing some of those forces that served as barriers to people seeking mental health services, I realized the importance of joining forces with faith community leaders. And I've actually, partnered with faith community leaders in developing educational tools, like a video. We this was before the days of YouTube. This video cassettes and DVDs and so forth. But anyway, I saw the importance of developing a video. Was called Black and Blue, Depression in the African Community, to help people see that a mental illness like depression, like all illnesses and diseases, are a cluster of symptoms that people may express in different ways. It doesn't look the same in everyone, but there are certain patterns that are common. And I was fortunate to engage with individuals who had experienced, Black people who had experienced depression themselves, who talked about their experiences and made it real, and hopefully helped to reduce some of the stigma and discrimination around having a mental illness, and being concerned about being thought of as weak or making excuses. But it's understandable, in our country, given the stigma surrounding just being an African American person in this society, it makes sense that people would be reluctant to accept another potentially stigmatizing label. I do think that the stigma has reduced somewhat, and maybe the pandemic and some of the collective traumas that Black people have experienced in recent years, especially with the killing of so many Black people, mass violence, such as with the Buffalo massacre in May of 2022, but then all of the killings of Black people, at the hands of police, have been a form of collective trauma that I think people have come to realize that this does indeed have an impact on our mental health, can affect our moods, can trigger depression, anxiety, extreme psychological distress, certainly compounded by things like the pandemic and some of the economic hardship that has accompanied that period.
Yeah, I mean, absolutely. I mean, you gave us so much in that, and I remember thinking while you were talking, my mama would often say, what happens in this house stays in this house, right? Like that was a mantra that you lived by, and still sometimes I'm like, oh, I probably shouldn't say. My mama would be mad if I said that out loud. But we learn that, we walk around with that, and to your point, it influences our everyday, and especially thinking about the last 3 years, and so much has happened. Like so much has happened, and for better or for worse, it has given us some permission to lean into self care and mental health care, and and I will say in the past year, more and more people that I talk to have talked. Oh, I talked to my therapist last week. It's becoming more just like I went to see my PCP, right? It's just part of your how you take care of your person. So I'm hoping, like you said, we're moving towards that and away from the stigma that was associated with taking care of your mental health and understanding that it's a disease process. A process. It's not because you're super vulnerable or weak or you can't handle it, right? You need to take care of it. It's just like taking care of any other um, acute or chronic medical condition. Um, Switching gears just a touch because I want to go back to the social determinants of health piece, and I want to talk a little bit more about young people, but I was remembering when I was in medical school, I truly enjoyed my psychiatry rotation. It was one of my favorites. I know I didn't want to be a psychiatrist, but it's just fascinating just understanding how the brain works and like how it's all interdependent on with everything else that's going through your body. Just a fascinating field in general. So much so that I did an elective in neuropsych as a fourth year because I was like, I just want a little bit more. I don't want to do it. I want a little bit more. But I also remember that I was at Vanderbilt and we still had an inpatient psych unit at the time. Like those are gone by the wayside at this point, but there were only a few of them then. And I was able to go on the adolescent inpatient psych ward for 2 weeks as part of my rotation. Because I was really interested in that time of like thinking about adolescent gynecology. And so I thought that would be a good rotation. But one of the things I remember is that some people were in there truly for psychiatric illness, but there were those that were coupled with really social issues that were identified as psychiatric conditions that then landed them in a psychiatric hospital. So, talk a little bit about not necessarily misdiagnosis, but this confluence of how social determinants of health can affect behavior and mood, and may lead to misdiagnosis, especially in young people. I think I think it happens in adults, but I think it's a little bit more, our young people are a little bit more vulnerable for that.
I'm not sure exactly what you're referring to, but certainly for communities living in very challenging, extreme and environments where, let's say, there's a lot of violence in certain communities, or people are living in poverty or in socioeconomic these stressful conditions, could cause anxiety, for instance, or depression. That you could say that it's an adjustment disorder, so to speak, as opposed to an actual, clinical diagnosis of mental illness, that could lead to someone feeling quite desperate. And maybe even if they are experiencing homelessness. And, there have been patients that I'm aware of that were in dire straits. And, they knew that if they went to the hospital and said that they were thinking of harming themselves, that they might be admitted. And as a result of that, they would, as we used to say, people would get 3 hots and a cot. They would have a place to stay, they would have food, and some support. And hopefully, social workers, nurses, psychiatrists, et cetera, there to assist that person, because we were very cognizant from day one of a hospitalization, of preparing for discharge and making sure that the person's home environment was set up, and if they did not have housing, to help them get housing and other supports to be able to stay in the community, because we've always been focused on the least restrictive environment. So that's one thing that comes to mind. I don't know if there were other instances that you encountered.
No, absolutely. I mean, the story I was remembering was a young woman who was in an unstable living environment, so was having some behavioral challenges and presented to the hospital, and kind of the sequence of events that led to an inpatient admission. But it wasn't. I think it was for her. Her behavior challenges were a result of her unstable living environment. And when she, to your point, she got to the hospital when she was desperate for some stability, and that was interpreted in a way that landed her in the hospital, which, I mean, it probably was actually a blessing at the time for her to have that little bit of reprieve, um, and hopefully she was able to with some support transition back into a stable environment. It's one of those things I don't know what happened, but um, it was just an interesting eye-opening experience of how these things could interplay. Um, and what people's conditions how they can manifest in the medical context. But um, so transitioning now to the Steve Fund, which is what we're really here to talk about. Tell us, I mean, what made you take on this experience? What drew you to the Steve Fund? Tell us a little bit about the work that they do there, and just introduce our audience to you and at the Steve Fund.
Thank you for that opportunity. I met the family who started the Steve Fund back in 2014. They had lost their son to mental illness. This is a prominent African American family who, after that experience, decided to really take up a campaign to make the mental health of young people of color a priority, and to really shine a light on the importance of that. And one of my medical colleagues was related to them. They were looking for an advisor to assist them in establishing their first conference, which was held at Brown University in October of 2014. And they asked me if I would help them identify various speakers, who could, enlighten the audience about mental health in young people of color. So I was able to do that, and I was a speaker at that program as well. And over time, the organization, which was a startup at that point, it grew and grew and grew. And since that time, I think we've had 9 or 10 other conferences at higher education institutions around the country. And the themes that we tend to focus on at those conferences have to do with belonging of young people of color in the higher education environment, and some of the mental health challenges and concerns that young people of color may face, especially those surrounding being a person of color in predominantly white environments, and some of the microaggressions and discrimination that they may encounter there, and how that might affect their mental health and well-being. And so we've been fortunate to bring together scholars and researchers and in the mental health fields and related fields to weigh in on various aspects of the mental health of young people of color, of a variety of different backgrounds. It's not just African American or Asian. It includes indigenous communities and Latinx communities, Muslim communities. We really are cognizant of some of the intersectionality when we talk about immigration, gender, the LGBTQ community, all of those identities that may overlap are also among the ones that we consider. We develop a variety of programs, workshops, and since COVID, of course, we pivoted and have offered several educational opportunities, through webinars and online conversations. We've also organized support groups and wellness circles to give young people an opportunity to engage with their peers, facilitated by a mental health expert, but to learn about what mental health is and what are some of the ways in which it connects with our physical health, and what sort of self-care activities people can do to maintain their well-being, and just some of the societal factors that come into play. I've been, an advisor, a speaker, a fundraiser, and a writer. I've written blogs for the Steve Fund. It's really been quite an engaging and rewarding experience to be a part of a team, dedicated to supporting young people of color in their mental health and well-being journey, as well as to support the people who support young people of color. That's very important too, their families, educators, and others in their lives. And this hasn't only been focused on the school setting, the college setting, but even the transition from high school to college, which is a very fragile period. And then after the college or the university experience, into the workplace. And we've had many initiatives working with large employers to focus on supporting mental health and well-being of young professionals of color as well.
I love that you took your strategy when you talked about working with the community early on in your career. And you said, I'm going to take the services to the people, right? And you really translated that here, right? You're going to take the services to the people. The people shifted a little bit, but your conferences are all across the country, right? You find where the need is, you find where people aren't necessarily
Yes.
asking for you to come, and you show up and you share. So much rich information and valuable information for very, like you said, fragile transition points in young people's lives. We're I know I had to let you go, but um, just as we close, and I always like to kind of look forward and think about what we're looking forward to or optimistic about. And so I'm gonna be a little bit unfair. I'm gonna ask you a two-part question. Um, the first part is for our young people who might be listening and may be struggling. What, how would you direct them in the short order? Um, and what advice, like, or what one pearl of wisdom or would you give them? And the second one is for the healthcare community or the academic center, those who need to reach this population. What's their next best step? What's their next first best step?
Well, for young people themselves, I think the most important thing is to remember that you are not alone. First of all, you're not the only one who may be going through a tough time or feeling kind of down or discouraged. I think it's important whenever possible to create a support system around you, whether that's your family, your friends, an educator that you have a good relationship with, or a mentor. And, it could be someone in your faith community. Uh, we all need support. And I think, the pandemic definitely taught us that. And, I think it's important also, if you are feeling badly, feeling down. I mean, we all feel down sometimes. We all may experience anxiety sometimes. But when it gets to the point that it's interfering with our functioning, our ability to function in our roles, as a student, being able to study, to read and to focus. If you're having that kind of difficulty, that is usually a signal that it's time to seek some assistance. And so being aware of what sort of resources there are, on your campus, whether it's a student counseling center or the infirmary, different schools have different models. But in those settings, there should be someone who could, be of assistance to connect you with the services that you need. And nowadays, there are so many websites where you can access care, and you can plug in your location or identify what sort of mental health professional you want to talk to in terms of your cultural background. And so that's a big plus now, the availability, and including crisis text line. For instance, the Steve Fund has a partnership with Crisis Text Line, where there are culturally trained counselors that are available 24/7, essentially no cost, just, the cost of your device, which you can use to communicate. And so, people can access those services on their own time. And so I think that's been a big plus, opening the door for people to access care, should they need that. And people should understand that they don't need to necessarily have a mental illness to seek therapy. It could still be very helpful in your growth as an individual and in your, maturation process, trying to understand the things that are going around you, the complexities of relationships, whether it's with your social group or with your family. Conflicts come up, and sometimes it's difficult to know, which way to go, or what your role is, or what your boundaries need to be, and that sort of thing. And of course, mental health is the ability to adapt to change and cope with stress. So sometimes we might need help with that. Sometimes we might be able to do that on our own, but it's good to know that there are therapists out there. I think that for educators and others around young people, family members and so forth, I think they need to be aware of the same things that I just shared, that they are not alone, or that if they're young person that they are concerned about is, showing some signs, or is acting a little differently, or not able to function like they used to, or, just exhibiting some change in behavior that, raises your antenna, be aware that there are resources out there. And I think it's important to show kindness and love and not be highly critical. That's not helpful, to people who are going through tough times. And so I think being understanding, showing empathy, compassion, and love is very important. And encouraging people that, just because you feel bad right now doesn't mean you're going to stay that way. Let's find out what are some of the tools out there that, you could use, to feel better and to get beyond whatever this stressful circumstance is in your life. So there's a lot of hope out there, and I think that we should be conveying that message. There's information. We can get information just at our fingertips at all times now. And so we can learn about mental health, learn about tools, resources, apps, websites. It's a horn of plenty, really. And, people can pretty much identify what they want and find it. So I think this is a good time. People are more aware of mental health than they've ever been. And it's keeping some of us in the mental health professions quite busy. So we've got to watch out for ourselves too, our self-care, so as not to get burned out.
Indeed.
But appreciate the opportunity to share about these issues.
Thank you so much. And, just to tell you what I heard is that we are not alone. That being a human and going through life is hard, and that's okay. There's help out there, and use your support systems as you can. But if you need professional help, that's okay as well.
Yes.
Therapy is not reserved just for a crisis. You can have it every day if you need to. Not every day, meaning every day, but that it is available as part of your general well-being. Um, and that we still, as healthcare professionals, especially as those who are dealing with high risk populations, still need to honor ourselves and take care of ourselves. And I think that's something we really need to underscore for those of us who are serving patients on an everyday in whatever capacity, especially in these past couple of years, that it's okay for us to take care of ourselves too. So I thank you that you mentioned that. And I, like you said, I think there's lots of things out there. This is a great time for people to get involved, to lean on people who know what they're doing and already have an infrastructure for help. So we are very grateful to be introduced to the Steve Fund. I'm so happy that we can share this with our audience, and so very grateful to have met you. You were such an inspiration, and I was very happy when we chatted before, and even happier that you agreed to chat with me again on the podcast. So thank you for all the work that you've done, and staying true to the calling that you had at such a very young age. And we know that you have changed so many lives. So just thank you for the work that you did.
Thank you so much, Dr. Fleming, for the opportunity. It's been a pleasure.
And so I look forward to staying in touch. Have a good rest of your day.
Oh, absolutely. Thank you so much. So take care. Talk soon.
Talk soon.
Thank you for listening to Read Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.